Okay. Okay, everyone, welcome and thank you for your time this evening and educating yourself on how to secure that residency you all are probably in the process of looking for. I know Justin from Student Affairs had forwarded me a couple of questions. I guess some of you had sent him prior to tonight's event. I also have some other questions we can ask Dr. Leibfried and Dr. Gallipani. And again, if any of you think of something, I'll be monitoring the chat room while they answer your questions. So feel free to type something in there. And afterwards, if there's something that, we haven't addressed and you still need some clarity, you can feel free to email any of us, okay? So I'll just have each of you, Dr. Leibfried and Dr. Gallipani, reintroduce yourself and just tell everyone collectively how you engage with students. I know each of you are involved in a residency program at your respective sites in some way. So I think it's best that they hear it from you. So Dr. Leibfried, I'll go to you first, and then Dr. Gallipani, you could follow, okay?
So I am a pharmacist. I'm clinical faculty. My site is the Valley Hospital in Ridgewood, New Jersey, which is in northern Bergen County. My area of practice is acute care and internal medicine. And I also do an elective rotation in nutrition support and drug information. We have 2 residency programs at Valley Hospital with 3 residents. So we have a traditional program, which is an inpatient pharmacy residency program. We have 2 resident spots there. And we also have a community-based pharmacy residency program where we have 1 resident slot there. And I am the coordinator for the community-based program.
Okay, thank you, Dr. Leibfried. Dr. Gallipani?
Hi, everyone. My name is Dr. Gallipani. I am clinical faculty in ambulatory care at Fairleigh Dickinson University. I think I have some perspective to bring tonight because I did residency. I did a PGY1 at Monmouth Medical Center with the RWJBarnabas Health System. I went on to do a PGY2 in ambulatory care at the Brooklyn Hospital Center. And now I'm fortunate enough to be a residency program director for our PGY2 in ambulatory care. So I have the student perspective and obtaining a residency, resident, and now program director. We have 1 position for our residency program, and I currently precept the diabetes medication management learning experience for our resident.
Okay, thank you. So I have quite a few questions, but the easiest way I think to do this is what I did with our earlier Zoom sessions. I'm going to kind of group a few questions together so we don't have to keep going back and forth. And then I'll have one of you answer collectively the questions, and then I'll ask the other to do the same, okay? So the biggest question that seems to keep coming up that students really want some true insight on is, what do you look for, or what are the overall characteristics or qualities, okay, in an ideal residency candidate? The next is, how do students make themselves stand out? Because obtaining a residency is very competitive. And the last question I'll group into these 2 is regarding a cover letter, is what in a cover letter makes a particular student stand out, that this is a student you'd like to interview further, okay? So Dr. Gallipani, how about you? I'll have you go first, and then we'll have Dr. Leibfried.
Sure. Thank you, Barbara. So the first question was, what are things we look for in a potential candidate? For our program, a lot of what we look for is communication skills. That includes written communication in your cover letter, as well as when you're interviewing. We look at the interpersonal skills when you have a conversation with the people you're interviewing with. We also look for evidence of direct patient care in your letters of recommendation and your references. So if you have preceptors that are able to speak to how you interact with patients and how you have conversations with them, that's something that sticks out with us too. Something that's Oh, something to make you guys stand out when you're applying. Of course, research experience is a big plus. I know that many students don't have the opportunity to participate in research during their learning experiences or rotations. So when we do see somebody that's presented a poster or done research or even like done a project, it could be like a medication review or a monograph or publish an article. Those are all really great things that that I think are not typical with every student that applies. And then the last question was, what makes a strong cover letter? This is something that is probably the most important thing that I look for as a residency program director. Like I said earlier, we get to see your writing skills, and you'd be surprised. Grammar is something that will take you a long way if it's properly written and you know how to properly address a letter, to who will be receiving it. And then even addressing it to the right program. I've gotten letters for the wrong program before. And then just in general, I think a strong cover letter is written in a way where the first paragraph introduces yourself or reinforces where you've interacted with the program director or the students or the preceptors. So that might be, I enjoyed discussing your residency program with you at ASHP virtual mid-year. I'm interested in your residency program because XYZ, and that statement should be something that is specific to that program. We don't want to see something like, because I'm interested in patient care. I mean, you can say that for every program. So look for something very specific to the program you're applying to. And then the following paragraphs would be, why the program is a good fit for you, and then vice versa, why you are a good fit for the program. It goes both ways. So when a cover letter is formatted in that way and properly written, I think those are what makes them really strong.
Okay, thank you, Dr. Gallipani. Dr. Leibfried?
So I think that what we look for and what could make you stand out, there's kind of two layers of that, because I think the first layer is getting the interview. So getting your letter and application past the screening process. We have for example, two inpatient spots. We interview 16 people and we get about 40 to 60 applicants. So you really have to wow us into making that first layer to bring you in. So I think that the cover letter is very, very important for that. And Alyssa kind of stole my thunder because everything that she's going to say, I'm going to echo. I think addressing it to the right person and being detail oriented. So spelling that person's name correctly, using the correct degrees and salutations. So, saying doctor if they're doctor, saying Mr. if they're Mr., saying Miss if they're Miss. I think those are very, very important. And that very quickly makes us roll our eyes if we're like, oh, they said I'm the director and I'm the coordinator. Like read the website. It's very clearly stated what my role is. So I think things like that are very, very important. Also things that are specific to our hospital and things, genuinely that you are attracted to. I read a cover letter for a student that I was helping, and he went on the hospital's website and he's like, oh, I really want to come to your hospital because you're a magnet nursing hospital and you do like CyberKnife for prostate cancer. I'm like, is that really why you want to do a residency there? Because they use CyberKnife for prostate cancer? Like, how is that even going to affect your residency? Like, you don't really care that they use CyberKnife. You're just picking things that they're proud of on their website. So, we want to see that there's something genuinely, because, people want to be liked and we want to be liked. And if you're going to write a cover letter, we want to know that you really want to come to our hospital and that you really know what our hospital is. Valley Hospital, for those of you that don't know, is in Bergen County. It's in a very upscale, wealthy community. And sometimes we're like, oh, I want to work with underserved people. I'm like, did you even Google our hospital? Like, this is not the hospital where you're going to work with underserved people. So, to make it very genuine and specific to the institution, I think is very, very important in the cover letter. So I think that's one way to stand out to get the interview. The other things we look for, there's really 3 things that we look for, which Alyssa also mentioned. One is grades. And we actually, believe it or not, don't look at the top of the class. Whenever someone's like the tippy top of the class, we're like, I don't know, like, can they talk? Can they counsel patients? Can they critically think and look at the gray area? But we do look at grades. We look at leadership and service. And I was just meeting with Tim before this for our advisor meeting, and you know, we don't want to see that you're a member for 6 different organizations. We would rather see that you're a member of 1 or 2 organizations and then a list underneath of things you've done. So it's easy to pay your dues and be a member of like 100 things if all you're doing is paying your dues. But we would like to see that you did student competitions, that you did brown bags, walkathons, blood pressure screenings, spoke on panels, mentored younger students, you know, that you really did something to make that organization better. That's really what we're looking for. And it doesn't have to be at the school. If you're doing things at your church, if you're a Boy Scout or a Girl Scout and an Eagle Scout, like all those things are very, very important because they show dedication to things that are hard and take a long time. And the third is research and projects. And what we're really looking for is, you know, not that you're curing cancer, but we want to look and see that you're doing something that is a lot of work that is beyond your rotation. And we want to see things that you worked on even after the rotation's over. So if you were on rotation with me for 5 weeks, but you did a project that took 12 weeks or 16 weeks, that looks really, really good for you because it shows that you were committed to finishing that, even though we were done together and I've given you your grade and you've moved on to another rotation. And then the last part is once you get the interview is getting the job. And that's when I think those softer skills come in, because you'd be surprised when we're ranking residents, how many times we're like, I just can't be on rotation with that person for 4 weeks. Like, I just can't, they just talk too much or talk too little, or they're clicking their pen, or, you know, they had no eye contact, or it was pulling teeth to have a conversation. And, you know, at the end of the day, a residency is work. And if I'm going to sit next to you for 8 hours a day for 12 months, like, you have to kind of be like normal and nice and personable and happy to be there and positive, and all of those things make a difference.
Great comments and great insight. I hope everyone is taking notes. This is very, very helpful for them. All right, so the first group of questions kind of focused on how to prepare, how to heighten an awareness of yourself and kind of sell yourself to the people that will be interviewing you. The next group of questions is, okay, you've sent in everything and now you get selected to interview. So now the next couple of questions are going to be ways in which a candidate can prepare for the interview relative to how to prepare if they ask any type of case-based questions, how to mention completion if they had the opportunity to do a mini residency, and if they've had any successes in that mini residency, such as research. Did they, you know, present a poster and it was selected for the poster session at ASHP? How could they weave that into the course of conversation? And then I guess, you know, any type of, you know, just regular clinical API successes. Maybe they didn't have an opportunity to do a mini residency, but they were very strong in maybe their core APIs. How can they highlight themselves in that? Okay, so Dr. Gallipani, I'll let you go first on that.
All right. So the first question was ways to prepare for an interview relative to case-based questions. This is always daunting because you literally don't know what to expect. My advice would be to think about your major disease states. You know, they're not going to ask you ways to, you know, cure these bizarre diseases. They will ask you, you know, if you see pneumonia, what are appropriate treatments, or, you know, what are things you would look at? If you have a patient coming in with a DVT or a PE, I know I've seen a lot of diabetes cases. I saw an osteomyelitis case once before. So really big, usually internal medicine type disease states. Usually these disease states are also, the cases are trickled in with a lot of secondary problems that you could strengthen if you're not too familiar with the primary problem. So Like, I remember I got an osteomyelitis case once and I was like, I have no idea. I don't even remember what antibiotic. But then I noticed the patient had osteomyelitis because they had diabetes and uncontrolled blood pressure and hyperlipidemia. So I really took those, my experiences from rotations and plugged it in where I can. So I guess the big thing is know your guidelines and just the major algorithms. They're not going to ask you for like, second, third line agents, standard of care for the main diseases. The second best piece of advice I can give you, because I learned the hard way, is to always ask if you can use references. So I went to an interview and they gave me the sheet of paper and said, here's your case. And I was like, okay, like, I'm just going to do it. And then I swapped with the next person and she was like, can we use references? And they were like, sure, you can use whatever you want. And I was like, oh my gosh, I was too afraid to ask. And I totally, I didn't have the same advantage because I didn't ask. So, ask in a polite way, are we permitted to use, like a case book? Sometimes they'll give you like a lexicon book. So just don't be afraid to ask. I wish I knew that. And then I guess the last thing, sorry, Maria, I hope I'm not like stealing all your answers, but the other thing too with the case is your thought process. So even if you don't necessarily,
now you're
sorry, I knew it was a Maria answer. So I can save that for you. I'll save it for you. I've been talking enough already. I was just going to say, have a rationale to your answer, because even if it's not necessarily what they're looking for, if if you're able to explain, well, I looked at this lab and I looked at these meds and I'm trying to avoid this interaction, that might gain you some points there. So just talk it out if you can, or write some rationale. And then the other question was ways to weave in success, like clinical successes, into your interview. That's a really good question, because these are things that are on your CV that honestly, like, I don't sift through a CV looking for all those details about, things you've worked on. And probably people don't either when they get 200 applications. I'm sorry, to be realistic. So what I would suggest, every program will probably ask you, what are your strengths or limitations? Or they'll ask you about, can you tell me a time where you, impacted patient care? And you can, I encourage you to think prior to like 3 or 4 examples, like clinical examples of things you want to just weave into that conversation as Barbara worded it, because you can do that for multiple types of questions. What are ways you did time management? Well, I managed my time because I worked on this project outside of rotation and I did that, XYZ. Or strengths of mine are multitasking because I worked on this project with Dr. Leibfried and, we presented a poster. So just have a few examples and then weave those into whatever questions. I mean, don't be obnoxious about it and weave it into every question, but at least have them prepared so that in the event you're kind of short on an answer, you have something else to elaborate on.
Okay, thank you, Dr. Gallipani. So I know Dr. Leibfried's just ready to jump right in here, so I'll let her go next.
So for the first part, preparing for interviews, I think that researching who's interviewing you can really give you a lot of insight in what they're kind of looking for. So for example, if you have somebody who is like for example, our residency program director is very, very active in the New Jersey Society of System Pharmacists. So if you Google his name, you will see like all of the stuff he's done to advocate for pharmacy. So, you would know when he's talking with you that that's his angle and that's what he's interested in. And so, if he's asking you a question, he may be trying to tease out what your level of interest in pharmacy advocacy, for example. If you have someone who's published a lot, they're probably going to ask you about writing. If you have somebody who has done a lot of community outreach, they're probably going to be interested in, can they bring you with them when they're at a brown bag or some kind of drug take back event? Would you be interested and willing to do that? So I think you know, people's areas of expertise and interests. So look at LinkedIn and look at the hospital website and Google them and try to see, you know, what is there, the bee in their bonnet. That will also give you a lot of insight into the kinds of cases, right? So if nobody there is into nutrition support, you're probably not going to get a TPN patient. If nobody there is ID, you're probably not going to get an ID patient. But if, you know, you have somebody who's a cardiovascular pharmacist and someone who's a certified diabetes educator, they're probably going to work together to come up with a case that overlaps between both of them. So I think that that could also give you a lot of tips into kind of what their priorities are and how you can speak to those. I think what Dr. Gallipani said about thought process is huge. We actually look at that more than your final answer. So if we're like, so what do you think? And they're like, I think you should stop the PPI. We're like, okay, well, I need more information than that. So, you know, I think that kind of using the PPCP to say, well, you know, I took all of this information, this is what I'm thinking, and this is what I would recommend. You know, and that is really what we're looking for in, you know, well, I don't really know about osteomyelitis, but I know that it's infectious disease. I would go to the IDSA guidelines. You know, since this is a child, I know that I can't use quinolones, even if that's first line in the guidelines. So kind of letting us know that you have a head on your shoulders and that you know stuff. And, you know, we go through that all the time because we're like, well, what if we pick community acquired pneumonia? And, you know, like one student just didn't have any idea on any of their rotations. Is that really fair? And we do have a lot of those conversations. And, you know, really what we're looking for is, because you're going to be on rounds and someone's going to ask you a question and you don't know the answer. And we can't have you just like dumbfounded and start to cry. And we've had people start to cry on interviews. So don't cry on your interview. But, you know, if somebody asks you a question, you can't just be paralyzed. You have to be like, okay, well, you know, this is what I'm thinking. I don't know if it's right or not. I would check with my preceptor before I said anything, but this is kind of the things that I know that I'm thinking. And that's really what we're looking for, because that's really real life. So, and then the third thing, you know, I really agree with what Dr. Gallipani said. Sometimes we'll ask people like, you know, tell me about a time when you know, led a group of students on something, and they don't say anything, and then they leave and we pull up their resume and we're like, wait, they were first author on a poster. And then it makes us wonder, were they not really first author, or did they not see themselves as a leader, or like, how come they didn't have their act together to bring that up, you know, when we asked them? And so then even though you have that, it just really kind of leaves a bad taste in our mouth, because really we jump to maybe they didn't really do it. Maybe it's not real. Maybe it's on their resume, but it's not real. So the more you can talk about something, the more it proves to us that it was real. So yeah, that's all I have.
Okay, very good points. You know, Maria, you had said something about, you know, if a student is asked a question and they don't know the answer or they get a little frazzled, how do you folks look upon a student who stays composed but says or asks, I'm not really sure of what you're looking for, or can you please repeat the question, to kind of maybe reset themselves to think a little bit in the background as they're asking the question? Do you think that's appropriate? What have you seen? So in the event, you know, there are going to be some nerves going on at the time. So what do you feel as an interviewer if something like that happens with a candidate?
So one thing that I can tell you, which actually happens a disturbingly amount of time with students and with interviewees, is people who say they're going to get back to you and they don't get back to you. And I know that we're always teaching students, just say that you'll get back to them. And I feel like we need to teach them, then you have to get back to them. So we have, you know, asked people things, and you know, I've gotten emails like 15 minutes after their interview is over because they've gotten in the car and like replied to our question right away. And that looks really, really great. Sometimes we'll get a reply like 3 days later, and I'm like, well, this doesn't really help us 3 days later because the patient would have died by now. So, you know, thanks, but that really doesn't help us. So, you know, it's okay if you stay composed. It's okay if you ask follow-up questions, because most of the times in pharmacy, if someone asks you a question, you know, it's not a knee-jerk response. Most of the time, you know, if they're like, oh, this person fell, what do I do? You're going to be like, well, how old are they? What were they doing when they fell? What drugs are they on? You're going to have like 10 questions before you can tell them what to do. So, if they ask you a question and you don't know, you can always gather more information. Like, is this an adult? Are they on other drugs? And that will help you kind of realize that you probably do know the answer, you're just overwhelmed, and that they know that you're critically thinking, that your answer will depend based on other things that they're telling you. I would really, in addition, I would really stay away from saying, I don't know, I'll get back to you, and leaving it at that. I would say, I'm not really sure right now, this is what I'm thinking, but before I commit to that, let me just make sure that I'm right and then get back to you. But we do want to know that you're kind of thinking. I think that's the most important thing for a resident, because we know you don't know stuff. That's why you're doing a residency, but we want to know that you can figure it out. Like, can you figure stuff out? That's really the most important skill, I think. I don't know if you have anything to add, Dr. Gallipani.
Right.
Yeah, I think something that you said that really stood out was escalating it to like a preceptor, for example. So I remember on one interview, they asked me, if a doctor were giving your patient warfarin, but they were in the hospital for a bleed, what would you do? And I was like, okay, I was talking out loud. I was like, well, they would have obviously an increased risk of bleed. So I would say that's not appropriate. Would you consider, doing something else? And they were like, no, but what if the doctor was truly adamant and said, we're going to give it, I don't care what you say. And I was like, I did not know what they wanted out of this question. And so this conversation went back and forth. It's like, don't give it. Just say you don't give it, document it. I don't know. And at the end, they told me they were looking for me to say that I would ask a preceptor. And I was like, oh, that was all they were looking for, right? So they didn't really care that, I knew clinically it would increase risk of bleed. They wanted to know if I knew how to ask for help. So, don't be afraid to incorporate that into conversation too. And then, yeah, the topic on not knowing, I think that really, I see that most when it comes to a case and you're doing a presentation and somebody always will ask you something random that you truly don't know. We see a person higher when they say, I don't know, I'll get back to you. Or, just like Dr. Leibfried said, give a little rationale and say, but I'll get back to you. That is so much better than guessing. Like, do not guess. If you guess and it's wrong, or if you guess and it's right, we can tell you're guessing. Just, admit that you don't know. It takes a big person to admit that in front of a group of people that you don't know. So, you'll get some extra points, I think, if you just have that self-confidence to say it.
And then get back to them.
And then actually follow through. Yeah.
Okay,
But-
very, very good points. Okay, next question is, some of our students here have had the opportunity to complete a dual degree while they were with us. So does a PharmD plus a dual degree increase chances of securing a residency? And how can the students highlight that added degree? Their interviewers, of course, are going to know that they have that from their CV. They may have weaved something about that in their letter of intent. But again, is there any way they can kind of highlight or use that to their advantage when they're in the interview process? So whoever wants to go first.
You can go first this time, Dr. Leibfried.
Okay. Well, one thing that I would say about a dual degree is that it really depends on the people in the audience. And we have a lot of conversations about this, about whether it's good or bad. And I think one of the things that is definitely a plus is that you are, if you're getting a master's in anything, anywhere, that's pretty impressive. And to do that while you're doing your PharmD is really very, very impressive. So there is that added level of like, wow, this is a really determined person. This person's great with time management. They're very committed. The question on the flip side, though, becomes, why would you want to do a residency? Why would you want to do a residency if you have an MBA? Why wouldn't you want to open a drugstore or go work in a drug company? And so I think if you're doing a master's degree and you're interviewing for a residency, I think you need to be prepared to answer either how that degree aligns with the residency, or what other things could they, or what's like the cliche of somebody with that degree that you would go into, and why is that not you? You know, so why did you get an MBA and you didn't apply for a fellowship? And I think, I don't know what the right answer is, so maybe Dean Rossi or Dr. Gallipani, you can help. There are times when people are like, well, I applied for a fellowship and I didn't get it. And we're like, okay. Yeah, and I know that's the reality, and I honestly don't know what would be an answer that would make me happy. But I do feel like, oh, we don't want to know that you didn't get that. So, you know, I don't know, but I would be prepared to answer why that makes you great, just the fact that you did 2 degrees. And I would also be prepared to answer, well, if you have a master's in regulatory, why aren't you looking at the FDA? If you have a master's in public health, why aren't you looking in the Department of Health? Like, what can that degree add to make you, what are you going to do with that degree in our residency program? I think that's a really important question that you should be prepared to answer.
So if I could jump in and just give a little insight from my perspective on that response, and I just want to hear from both of you how you would take a student saying this, okay? If a student had an opportunity to take and complete a dual degree at a very good financial price, okay? If they said that it was opportunistic for them to have completed the degree while they were doing the PharmD, they don't know yet where that knowledge is applicable, but it may be in this residency, it may be down the pike. You know what I'm saying? What they do post the residency. So would that be an appropriate response for a student to say? Would that be acceptable?
Yeah, I think I would like that. And, you know, my next question would probably be, well, why this master's? Why a master's in public health? You know, if all you wanted was, not all you wanted, but if what you wanted to do was check the box of having another degree that makes you marketable, how did you pick this one?
Mm-hmm. Okay, that's a good point. That's a good point. But I think, you know, especially in today's climate, economically and financially, with students having, you know, a lot of loans that they need to pay off down the pike once they graduate, the opportunity to get some of our dual degrees at, you know, for no cost or maybe a little bit more, you know, is really opportunistic. And I know if I had an opportunity to do it when I was their age, I certainly would have secured it, but I went after my, you know, after my BS and I got it separately. So, but just a thought. So Dr. Gallipani, how do you feel about that response?
I think the opportunity, I mean, I think the way to kind of twist it is that, you know, even if it's not pertinent at that residency per se, like an MBA, it still shows that you can multitask and you have good time management and you're proactive and you're eager to look into new learning experiences. If somebody on an interview tells me that they're open to new learning experiences rather than saying like, I have an MBA in, you know, or, you know, I have an MBA or a master's in IT and that's what I want to do and that's it. You know, we want somebody open-minded also to learning something new. So just make sure to not sell yourself too, you know, too much that you know you're going to do something, you know, during the residency. So it's actually funny because we had a resident apply for our PGY2. I'm just thinking, I don't think anyone knows her, but she was an accountant prior to interviewing for our PGY2. And we were like, that's interesting. Like she literally like got her degree in accounting. And she kind of sold it to us when she came on her interview and she brought us, you know how you print out the slides for your case presentation, and she actually printed out her slides, put them in a binder, labeled the binders, and each one of us got this beautiful binder. And we're like, wow, like the organization skills, you know, even though accounting has nothing to do with probably what you're going to do in our residency, she is numbers based, detailed, very detailed and organized. So we kind of took those as advantages. So, you know, I think there's ways to pull it as a strength, but on the other hand, if you don't have it, I would consider you even playing field to someone who does have the degree. I don't think it adds or takes away really.
Okay, thanks. Okay, I have another question. So, do you suggest applying for the same type of residency at multiple institutions? Or if you have one institution that has a whole bunch of residency opportunities, do you apply to different ones within the same institution? And this is where we run into students that they want a residency, but they're still a little unsure of which particular one they want to pursue. So what are your ideas or opinions on applying for the same type of residency at multiple institutions or all different kinds within one real big institution? So Dr. Leibfried, I'll let you go first.
Oh gosh, this is a hard one to go first. And you know, this happens a lot with us because we have two very different residency programs. Because we have the inpatient residency and the community-based residency. So sometimes we get people that apply to both. There is some overlap, but I feel like the goals of the residency are different. So really a lot of times our antenna go up and a lot of our interview is trying to find out, why would you apply for both? Are you just casting a wide net and you don't really know? I mean, we do have people who are like, I love Valley, I live here, I know it's a great hospital, I want to do a residency here. And we're like, you know, yeah, like you're saying all the nice things, but just because you live here and you were born here doesn't mean this is the place for you to do a residency. So I would recommend applying to the same type of residency at different institutions, unless the residency programs are similar. So that's my recommendation.
Okay, Dr. Gallipani?
I can kind of add like an opposite perspective. So I'm a residency ambassador with RWJBarnabas Health. So what that means is I work for our system and I help students navigate between different residencies within our system. So for example, we have 11 or 12 different PGY1s, and we every year, I mean, before COVID, we'll host a dinner and have applicants come and talk to the RPDs of those programs. And then what we see is somebody, oh, I'm interested in Monmouth Medical Center. And then, you know, they sell you on that. And then I look around the room and they're going to another hospital, all within our same system. And, you know, it's fine. I encourage you to apply to multiple ones, but just make sure there is some sort of clinical overlap. You know, we're not going to say, oh, like they applied to Newark Beth Israel and St. Barnabas, like they can't decide. I mean, most of our programs are general. So, you know, if you're applying to like general PGY1s, that's fine. With us, because I'm the program director for our AmCare program, we get a lot of applicants that also apply for our PGY2 and geriatrics. And then, you know, people that interview with me who might not match with me get matched at the hospital next door at the geriatrics program. But then, you know, they have an overlap. I'm like, I get it. Most of the geriatric patients are outpatient AmCare anyway. So that to me makes sense. I think this question I see a lot more with fellowships, and Dean Rossi, you can definitely speak to that. But I think that's where it gets cloudy when like Bayer is offering 8 different fellowship programs and then you apply to, you know, 5 of them. I know vaguely that there is some overlap between, you know, what you're interested in, it's marketing or public relations, those might be similar, but not applying to, you know, different things that like have nothing to do with each other.
Yeah, you kind of hit on it, Dr. Gallipani. So, and this is residency based, so I don't want to take what little time we have left talking about fellowships because we already had a session on fellowships earlier. So another question, I just have one more regarding the interview process. And then I just have some general questions about residencies for some feedback for the students. So at the end of the interview, I know what interviews I'm involved in with the fellowships is we always give the student an opportunity to say, you know, are there any questions that you have that we haven't covered? So is there a good last question during a residency interview if the students are given an opportunity to ask, you know, do you have any additional questions you'd like to ask the interviewers? Is there anything, you know, that kind of stands out with, oh, gee, that was a really insightful question, you know, that the students asked? So that's my question. Dr. Leibfried?
Know that there's like a right or wrong, but there are some powerful questions. And I think the one that's most memorable is I was asked, why do you love working here? And I was like, I just love working here because it's Valley and it's just, can't you just, and I was like, oh my God, like I have to give them a normal answer because I expected normal answers from them all day long. You know, and it gives you the opportunity to think about, you know, why do I really love working here? And I think that that also is a way for you to tell, you know, do people that work there really like working there, or is it a toxic environment? I know that when you first start looking, you know, people are like, I just want to do a residency to say that I did a residency. And then when you start going, you know, you're going to be going to work there all day long, every single day, probably more than 5 days a week for a whole year. So, you know, you really want to make sure that the culture and the values align with what you want. And, you know, are the people that work there happy? And that's a really big statement. But that was really, I think, the wow question that I was like, wow, that's a really good question.
Okay, I hope they all wrote that down. So, okay, so Dr. Gallipani, anything from you?
I think something that goes unasked a lot is for the resident, what do you wish were different, or what could you change if you had the opportunity to? I remember being asked this and I really had to think about it. I felt like nobody really asked me. They would say like, oh, what's your day-to-day like? And then, you know, every 10 minutes I'm explaining my routine and, you know, what do I like about it? Great. But what do I wish I could change or do differently? I think gets a person, you know, really thinking, and that teaches you a lot too. Oh, I wish I, you know, had more free time to do blah, blah, blah. I'd be like, ooh, you know, you'd want to know that. The same goes for with preceptors or program directors. You know, what are some things that you see changing in the next year? That's going to take you to be a little bit more up to date. While I see, you know, with COVID vaccines rolling out, I see you kind of being in the community more, working in the mega centers. Like that will impact your residency for sure. So, you know, you would want to ask that. And then I remember being really intimidated with the last questions, right? Because we're trained to always have questions at the end. Okay, what questions do you have for me? But then I always felt conflicted as to like, well, how many questions should I keep asking? And I remember one interview, I literally was pulling questions out of nowhere because I just kept going and going and going until he told me we couldn't anymore. So then as I started interviewing people, I would notice people say, okay, and my final question is, and then they would ask whatever question it was. And then that kind of sets the tone a little bit. So you're not just like, that's it, or I don't have any more. You're kind of prefacing, oh, my final question I have for you is blah, blah, blah. So then at least it wraps up the conversation a little bit nicely.
Okay, good insight. Now, this is a stickler for me, okay? So I just want to see if my two colleagues over here feel the same way. After the interview, there's something that I think and I feel really sets a student apart from their peers in the competition process. What do you feel is an important thing for students to do after the interview?
Maria, I feel like you had something to say, so you can say that and answer first. Like
something about questions, to not ask questions that are the answer is available someplace else. So don't say, what residency project is everyone, you know, are people working on if it's on their website? So that is very fake. But anyway, so what should they do after the interview? Well, if you said you were going to get back to them, I would get back to them. I would also, you know, I think it's a really good habit and life skill to send a thank you email.
Thank you. That's me. That's my pet peeve. So I'm glad that I heard somebody else say that. Okay.
Now I know if you're ever interviewing me, Dean Rossi, I know how to win you over. I think it's important to send a thank you email. And I think it's nice to, first of all, make it genuine. You know, as Dr. Gallipani said, we can tell if you're lying. We can tell if you're not genuine. We can tell if you're there just because you're there and you don't really want to do a residency and wear your safety or whatever. You know, so something that really kind of inspired you, or was something new that you learned, or something that you're especially looking forward to, you know, I think is a nice touch, like something that like, oh, and I learned, you know, I was happy to learn, or, you know, it's nice to see that these are the changes you're thinking of making and I'd love to be a part of that. So, you know, something specific instead of a general, you know, after our interview, I'm confident that my skills align with what you're looking for. I'm like, okay, are you? So, you know, I think that a short and sweet email, thank you, highlighting specific things that you actually got out of the interview is very, very nice. Handwritten notes are nice, but they really get lost in the web of inter-office mail at the hospital. And sometimes we're getting handwritten thank you notes like weeks after the residency. So the old me would have said, yes, a handwritten thank you note, but it really takes, and then, you know, they're like looking for me, and, you know, nobody like sends paper mail anymore. We don't even have a process. It just gets like stacked in our break room until people come by and claim it. So I would say email is the way to go.
Okay, thanks. Dr. Gallipani, anything to add?
I completely agree. Thank you emails specific to your conversation. The specificity will help them remember you too. Some programs will interview like 4. I was part of an interview that they interviewed 4 people at a time. So you want them to remember you. And then with the emails though, I think it was Dr. Leibfried, one of your directors, said that like Tuesday, and this is a hot topic, but like Tuesday mornings are like the best time to send your thank you email, because if you interview on a Friday, they're not going to check their email, and then it gets stuck all the way at the bottom over the weekend. And then Monday comes and it's full of junk. And then Tuesday, you've got a fresh, clean inbox and your thank you is right at the top. So, I mean, you could take that risk if you want. But what I also notice in thank you emails is we know when you copy and paste things, if you use the same email, and then even if you copy and paste like and adjust a sentence, right, that specific sentence, for some reason, I don't know if it's like my eye, but I can always tell if it's slightly grayed off or the font size is a little off. So if I were you, I would put it in Microsoft Word first, edit it, and then copy and paste it. I don't know. It just like puts a weird taste in my mouth, like having it blatantly there, like they copy and pasted this thank you email from another person. Put the correct name. You will come this close to sending the wrong thank you email to the wrong person. So just, again, that's why Microsoft Word at least gives you like an ability to second check it, or just, you know, take a double look. Same thing with the handwritten, and that doesn't really, it can add if, you know, but they come so late, they'll come like over the summer. So I would focus on the email.
Very good points. And I'm just going to add another point. Make sure you're addressing people with the appropriate title and position within their organization. A lot of students don't realize that these people have worked very hard to attain where they are. So to just address them as, you know, Miss or Mr. or whatever without the appropriate title is sometimes a little bit of a turnoff, and may put your application in a circular file without them looking at it further. So just very, you know, very appropriate insight for this particular question. So
Barbara, when we were recruiting at mid-year in person, people would come up to me and say, oh, what's your favorite part about being a resident in this program? It's like, I'm the director. And
don't assume.
While it's so flattering, I have a name tag that literally has my name on it and my title. So,
yeah,
you know, just
excellent
even,
point.
You know, the virtual showcase, just be careful.
Yes, excellent point. So, okay, we have about 10 minutes left here. So since all of our students who are pursuing residencies are in a clinical career path set, what I would like to find out is if they would like to secure a clinical position within a hospital or an institutional setting, if they're not successful, which I hope everyone on this call gets the residency of their dreams, but if they're not successful, then is there really a need to complete a residency to secure an institutional clinical pharmacy position? How difficult is it? And even in these times with, sometimes you hear there's, they're not hiring full-time clinical pharmacists, they're hiring part-time. So just a little insight on the need to secure a residency, or if they're not fortunate enough to get one, can they still secure a position as a clinical pharmacist in an institution? Okay, so that's one of my questions. Dr. Leibfried.
Yes. We have at our hospital about 60 pharmacists, and I want to say maybe 10 of them have done a residency. So it's definitely doable. I think, it's a little bit less desirable position. So, starting maybe per diem, part-time, evenings, overnights. And you have to also kind of prove yourself that you can do more. And one really great way to do that is to say yes to things. We're always sending out emails that, we need someone to go do a brown bag. We need someone to give flu shots, at a community outreach. We need someone to go to the library and give a presentation on vitamins. Excuse me. So our department is always sending emails out with like additional drug information projects that we need, or come speak at FDU. And the more things that you say yes to, they will start seeing you in that way. What's nice about a residency is that we make you do all those things, so you have a really great resume that already shows that you can, take initiative and lead projects and go above and beyond. So, the harder part, if you don't do a residency, is that you have to kind of take those opportunities and do it yourself and take initiative. So, that being said, it definitely can be done. So, I wouldn't think that if you don't do a residency, this is the end of the world and you'll never work in a hospital, because that's actually not true. You still can get a hospital job if you don't do a residency.
So Dr. Leibfried, I just want to ask a follow-up question on that. If students are unsuccessful their first attempt at a residency, there's no reason why they can't apply for another one in a year, correct?
Correct.
Okay.
Yeah.
Okay.
Or even if you don't apply this year, we have people who've worked 1 or 2 years and then applied.
Okay. Dr. Gallipani, do you have anything to add?
I would encourage you guys to take advantage of like networking opportunities if you don't, if you don't get a residency position. I think what I've noticed is sometimes like an email will come through and be like, oh, so-and-so knows this person looking for a position, odds are that you wouldn't vouch for them if they weren't going to be a good worker. So if there are people that or can network somehow, I would encourage you to take advantage of that, just to at least get your foot in the door. And like Dr. Leibfried said, some of those less favorable shifts, overnights, or even per diems, I've seen people take the per diem positions and then go to part-time really quickly. And even having that part-time position, you can still take advantage of, those volunteer opportunities that'll be extra, but it'll be worth it. And I've seen pretty commonly people take a year to work, even, in a retail setting, or, some maybe something not necessarily in a hospital, and then they'll take their time and come back, and that's okay. When you interview, just make sure that you sell it as an advantage, which I consider it to be anyway. You have experience, if you went to CVS for 2 years, I have experience in patient care. I communicate with patients, I communicate with providers, I manage, I multitask all the time. So just make sure that you incorporate it into your strengths. And people will say like your odds of getting a residency are less likely after, but there's literally no reason that you can't be as eligible as somebody else. So don't let people like convince you not to apply the following year.
These are great points. Okay, this is the final question for the evening, and this particular question was submitted to Justin in Student Affairs by one of our students. And this is going to be an opportunity, I guess, for each of you to talk a little bit about your residency. So the question is, what is the most valuable lesson you've learned from completing your pharmacy residency? And that will be our last question. So Dr. Leibfried, I'll let you go first.
Okay, so I did my residency at Montefiore Medical Center in the Bronx. I think the most important lesson that I learned was how many different places in the hospital pharmacists could work and could benefit the health system. You know, we had investigational drug pharmacists, critical care pharmacists, pediatric pharmacists, oncology pharmacists, staff pharmacists, supervisors, managers, patient safety pharmacists. I mean, all of these different things that were just so exciting and so eye-opening, that I really think that's an advantage, is to get to see what those people do and spend time with them during your residency. It was really very wonderful. And then, you know, I was able to take that to other places and be like, you know, did you ever think about having an investigational drug pharmacist? Because I did a residency, so I could, you know, I could set up like any of these programs for you because I've just done it. And so that was really, really amazing. And it really opened my eyes to, when you're applying for jobs, the different things you can look for and the different things that you're qualified to do as a pharmacist, even if pharmacy is not in the title.
Thank you, Dr. Leibfried. Dr. Gallipani.
I think for me, the most important thing that I learned is how much of an impact and how important pharmacy leadership is to your training. You know, when I did my PGY1, I felt like the director, our chief pharmacy officer, our clinical director, they would advocate for you. They have your back. They encourage you to, you know, to learn as a residency, and they don't look at you as just like, oh, it's the resident, they're doing their thing. They really value you, and to have a team and, you know, have those leaders that see your value, especially as a resident, where people just see you as somebody who's, you know, here to do work, that will totally be a game changer for your residency program. I feel like I can say this because I had one program where I truly saw those leadership skills, and then I did my PGY2, and the leaders were very absent. And when I was done, I was like, wow, what was the major difference between those? And it was really like the gut feeling you get when the people that you're working for value you and respect you. So go with your gut when you go on interviews, because it's not a tangible thing, but if you're cognizant to look out for it and even ask questions about, you know, those in leadership positions, I think you'll get some clues about whether or not an institution is, you know, the right one for you, or maybe if you just can't decide which one might be, you know, teaching you some of those other leadership skills too.
Thank you, Dr. Gallipani. Well, it's almost 8, folks. So on behalf of the school and each of you, I am thanking Dr. Leibfried and Dr. Gallipani for a very insightful, informative, and realistic overview of what it is to apply for a residency, stand out, answer questions, I guess, conduct yourselves with your body language and your eye contact, and just to kind of, you know, take the opportunity to kind of highlight yourself and what you've done and accomplished during your time at FDU. So I wish you all the best. Happy early weekend to everybody. And again, many thanks to Dr. Leibfried and Dr. Gallipani for their time and insight. So
thank you everyone for your questions.
Thank you. Thanks
everybody,
everyone for
have
coming.
a good night. Okay. I'm getting a lot of thank yous coming in. So thank you so much. Thank you both. Thank you all. So it looks like it was very well received. So thanks
Thank you
again.
for inviting us.
Okay.
Yes, thanks for thinking of us. Thanks everyone for coming.